Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about mosquitoes. And our special guest is Dr. Randall Culpepper, Deputy Health Officer at the Frederick County Health Department. Randy, welcome. Thank you for joining us.
Thank you, Barbara. It's good to be here. Thanks for asking.
Yeah, well, I know a lot of people are talking about mosquitoes, so what's all that talk about?
You know, it's interesting. There is a lot of talk about mosquitoes. There's a lot of information on the TV, on the news, and the newspapers. I think what we're seeing is, much like we did about 15, 16 years ago with West Nile virus, when we knew that virus was spreading across the United States and spread by mosquitoes, there's a lot of concern. How do we prevent mosquitoes from biting me? How do we control mosquitoes? I think now that we're seeing this outbreak of Zika virus spreading from South America throughout the Caribbean, Central America, and probably even eventually into the southern states of the United States, we're a little bit worried about this particular virus and its spread, and how can we keep the mosquitoes from spreading that disease?
Yeah, okay. Well, that's what I'd like to know too. What can people do at home?
There's a lot they can do. I want to talk a little bit. We all know about mosquito control activities when you see the trucks fogging down the street and things like that. But, you know, those are really emergency procedures to control mosquitoes. It's something that's done in extreme circumstances. But I think we have the opportunity as residents to really take some actions around our own homes, because that's, after all, where the mosquitoes are. So I think if we think about the 3 Ds of mosquito control, you can think about draining, dressing, and defending ourselves against the mosquitoes. And I could talk about each one of those.
Okay, all right, yeah. Let's talk about drain first. Right, 3 Ds, right?
The 3
Drain,
Ds.
dress, and defend. Okay, do drain.
That's it, the 3 Ds. So the first one is draining. So we always think about where can we prevent mosquitoes from breeding, and mosquitoes have to have water to breed in. But mosquitoes can breed in as little as a little cup of water, or even just an ounce or two. It doesn't take much, because a female mosquito lays her eggs around the side of that container, and then once those eggs get covered with water, they'll hatch in about 5 or 6 days. And that's where most of the mosquitoes come from that we experience around our home. So if we make sure that we've drained any containers or any areas around our house that has standing water, it'd go a long way to reducing the mosquito population. So I just kind of take a mental image in my mind around my own home. Where would I think about? I might have some children's toys outside that might be having some water in them, maybe the wheels. Certainly the pots that we plant things in, we could make sure those are drained of standing water. A lot of people might have a boat or a canoe or some kind of equipment outside that might have water in it. Bird baths, another good example. If we think about going up, I always think about trees, and sometimes there are little holes in the tree trunks, little knots that sometimes holds just a little cup of water. That's another good area too for mosquitoes. And all the way up to our gutters. If your gutter's clogged with leaves and debris, you want to make sure those are clear and clean so that no water stands in them. And you should really be thinking about, if water does accumulate, change it every 5 or 6 days.
Wow, you're right. There are a lot of areas that we all should be thinking about. So it's not, people might normally be thinking about, oh, I only need to be concerned if I live near water, but you're right, water is all around us, including the gutters.
Yeah, including the gutters.
You mentioned that one.
And you mentioned we all have water around us, but it's really the standing water that makes a difference. If you've got a stream in your backyard or a nearby pond that's draining, you don't have to worry about those areas, because it's usually the stagnant water that really breeds mosquitoes, not the running water.
Okay, well, great. Okay, so that was drain. I think dress was your next one. That's
a good one. We know that some mosquito species like and prefer dark clothing as attracts them. So if we can think about when we're outside in the times that we're having biting mosquitoes, which is unfortunately for these mosquitoes all day long, but especially at dawn and at dusk, think about wearing a lighter color clothing. It will be very effective. Make sure the clothing is loose-fitting, because if it's tight on your skin, mosquitoes bite right through it and get right into your skin that way. So light-colored clothing and loose-fitting clothing, and something that would cover your arms and your legs, and not just a tank top or something that exposes a lot of your skin.
Right, right. Okay, so the 3 Ds, drain, dress, and now defend. Tell us a little bit more about defend.
Yeah, that's a good one. That's really, if all else fails, this is really our last resort. And so you can defend against mosquitoes getting exposure to you a couple of ways. One, to make sure that you've got your screens in your house that don't have holes in them and that are intact, so that mosquitoes don't get inside your homes. But also, we always think about insect repellents, and that's usually what people think about first, because they're very popular. If you look on the store shelves, there's probably dozens of different kinds of insect repellents, but they're good, they're effective. But you've got to make sure you're using an EPA-approved insect repellent. And there's really 3 chemicals you could probably think of that would be effective. One would be a chemical called DEET. It's D-E-E-T. That's probably the most well-known insect repellent that we use. If you find a repellent and it has DEET, you want to make sure it's only got about 30% concentration. If it's higher than that, it's just wasted, but then it also exposes your skin to more concentrated DEET, and that might not be a good thing. The second chemical is called picaridin. You see it in just a couple of products. It's not very popular, not as much as DEET. And the third is oil, actually, oil of lemon eucalyptus. There are some products that have this in it. And all 3 of these have been proven by scientific studies to be effective in repelling mosquitoes off of your skin. But there's some issues you want to think about.
Okay, well, don't leave me hanging. So what are some of those issues I want to think about? And I'm thinking about pregnant women, children.
I'm glad you asked. That's exactly right. Even though the American Academy of Pediatrics has said it's okay to use insect repellents on children 2 months or older, you want to make sure that you don't use it with a lot of repellent on their skin. Use it sparingly. Again, follow the directions that are right on the bottle or the can. And by all means, for children, don't get it on their hands, because the first thing kids do is put their hands into their mouth or their eyes. And you don't want to spread those chemicals into those areas that might get inside the system. So for children, use it sparingly. Just don't put it on the hands or anywhere near the mouth or eyes. For pregnant women, we have similar concerns, but I would just recommend for pregnant women to dress as best as they can to keep any mosquitoes from biting them in the first place. If they have to use repellent, just use it sparingly and don't leave it on for long periods of time.
Okay. All right. Well, so you've given us the 3 Ds, what people should be thinking about and doing this year. So let's see. So that's the drain, dress, and defend for mosquito control. Is there anything else that you'd like to share before we close?
I do. If people use insect repellents, I want to make sure that you wouldn't use anything that if you got a cut or an abrasion or something on your skin that chemical could get into, don't use the repellent on there at all. If you put the repellent on you and you have an adverse reaction to it, if you have a red rash or itching or something that goes bad, the first thing you want to do is go inside, wash it off with soap and water, and get it off of you. If you're still having any symptoms, I think you'd want to for sure see a doctor right away, either an urgent care or your family care doctor or somebody, but just use it properly. And again, use it the way it's labeled.
Okay, very good. Well, thank you very much for joining us.
Thank you, Barbara. Enjoyed it.
And now please stay tuned for this month's Medical Myths.
Join Frederick County Parks and Recreation for some hands-on cooking classes at the Ballinger Creek Community Building in Frederick, Maryland. Some of the classes offered include cooking with your kids in our parent and child programs, have a night with your significant other in our date night classes, learn cuisines from around the world, or learn some basic cooking techniques. For more information, visit us at recreator.com or call 301-600-2936. We'll see you in the kitchen.
If your child enjoys being outdoors, then the Nature Academy program would be a great experience for them. Young children will use their senses to observe nature up close by getting muddy, putting their feet in the creek, and holding nature in their hands. This program is full of fun activities, but also a great learning experience. This is an outdoor class, so please remember to dress appropriately for the weather. For more information on this program, please visit recreator.com.
And now here's this month's Medical Myths. This month's Medical Myths is about pain medicine. Many Americans suffer from chronic pain. These patients deserve safe and effective pain management. Prescription opioids can help manage some types of pain in the short term. However, we don't have enough information about the benefits of opioids long term, and we know that there are serious risks of opioid use, disorder, and overdose, particularly with high dosages and long-term use. It is estimated that as many as 1 in 4 patients receiving long-term opioid therapy in primary care settings struggle with opioid use disorder. So the first myth is that opioid or narcotic pain medicines are effective long-term treatment for chronic pain. While evidence supports short-term effectiveness of opioids, there is insufficient evidence that opioids control chronic pain effectively over the long term, and there is evidence that other treatments for chronic pain treatments can be effective with less harm. In a systematic research review, opioids did not differ from non-opioid medication in pain reduction, and non-opioid medications were better tolerated with greater improvements in physical function. Opioids are not first-line or routine therapy for chronic pain. The second myth is that there is no unsafe dose of opioids as long as opioid amounts are increased slowly. Well, daily opioid dosages close to or greater than 90 MME, or milligrams morphine equivalent, per day are associated with significant risks. Lower dosages are safer. When opioids are started, they should be prescribed at the lowest effective dose. The third myth is that the risk of addiction is minimal. That is false. Up to 1/4 of patients, that is 1 in 4, receiving prescription opioids long-term in a primary care office struggles with addiction. Certain risk factors increase susceptibility to opioid-associated harms. A history of overdose, a history of substance use disorder, higher opioid dosages, or taking benzodiazepines, a type of tranquilizer often prescribed for anxiety and muscle relaxing. In conclusion, before starting opioids to treat chronic pain, patients should make the most informed decision with their doctors. Learn about prescription opioids and know the risks. Consider ways to manage pain that do not include opioids, such as physical therapy, exercise, non-opioid medications such as acetaminophen or ibuprofen, and cognitive behavior therapy, also known as CBT. That's this month's Medical Myths. And now, here is this month's health tip with Amber Nally.
Hello, this is Amber Nally, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Prevention Services Unit of the Behavioral Health Services Division. April is Alcohol Awareness Month, and the Frederick County Health Department joins other health professionals across the nation to raise awareness around alcohol use. This year, the National Council of Alcoholism and Drug Dependence, Inc. highlights the important public health issue of underage drinking. The theme is Talk Early, Talk Often. Parents can make a difference in teen alcohol use. According to the Substance Abuse and Mental Health Services Administration, it is estimated that each day in the United States, 4,750 kids under the age of 16 have their first full drink of alcohol. Locally, according to the 2013 Youth Risk Behavioral Survey, 1/3 of Frederick County High School students reported having at least one drink of alcohol on one or more of the past 30 days. Alcohol use by youth can cause changes in the structure and function of the developing brain, which continues to mature into a person's mid-20s. Other consequences of underage drinking can include problems in school, social, and legal problems. According to the Centers for Disease Control and Prevention, youth who start drinking before the age of 15 are 6 times more likely to develop alcohol dependence or abuse later in life than those who begin drinking at or after age 21. Research shows that kids who learn about the dangers of underage drinking from their parents are up to 50% less likely to experiment with alcohol than kids who don't. For more information and resources on how to talk to your kids about alcohol, please visit SAMHSA's website. Here at the Frederick County Health Department, the Behavioral Health Services Division offers a variety of services and prevention resources for parents, youth, and the community. Resources are available for adolescents, adults, and families in need of substance abuse and mental health treatment. For more information, call 301-600-1755 or visit our website. Lastly, if you are concerned about a suspected party involving underage drinking or drug use in Frederick County, please contact the Underage Party Tip Hotline. Give the address of the party, the time, and the date. Callers are not required to give their names, and all information is confidential. So talk early and talk often with your kids about alcohol use. It's worth it. Parenting is prevention. Thanks for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.